Multidisciplinary pain control in cancer patients, it's so obvious that I don't believe that exists another way to treat these patients. So I've decided to talk about why you need a team, why you need a multidisciplinary approach for these patients. You need to understand the impact, the diagnosed impact. When you treat the cancer patients, you are talking about a patient that 1 week before the diagnosis has been living their lives normally. Was a teacher, was a lawyer, was a doctor, that felt some discomfort, seeks a doctor, make an exam, and receive the diagnosis of cancer.